about TCM tidbits, where life becomes better living. And today's topic is the gallbladder. Do you sigh frequently? Do you feel that you have a lump in your throat, but that nothing can be found from your doctors? Do you ever feel that there's maybe a bitter taste in your mouth, even though you just didn't eat anything that was bitter? So if so, these could be possible indications of your gallbladder organ pathway having some level of disease orientation. So let's prevent. The gallbladder, pathologically, as we know, pathophysiologically, it stores the bile and it excretes it to the intestines for hopefully healthful digestion. So if we have to keep our gallbladder healthy, we want to avoid fatty foods, avoid foods that are dairy, even coffee can be a sensitivity, and avoid greasy foods. We can also have poor sleep, sigh frequently, and have bloating if our gallbladder is not optimally healthy. Foods that we can eat that might improve the condition: lemon, lime, plums, and pickles, to name a few. Thanks for checking in. Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Please subscribe. Keep these wellness tips coming your way. And just good the math.
So you're already using ChatGPT, and while that's awesome, there is one little problem. You're not making any money with it. And I'll tell you right now what you don't need. You don't need a better prompt. In fact, you can be the best prompt engineer on the planet, and that's not going to make the cash register ring. My name is Matt Lights, and since 2008, we've been helping businesses of all sizes, from brand new startups all the way to over $100 million and more, to use AI and chatbots to absolutely dominate. It's taken our tiny little company and put us on the Inc. 5000 list in back-to-back years, and it's helped our students and our clients generate millions of leads, and I don't even know how many millions of dollars in sales. Most importantly, we help people like you create amazing customer experiences. Because here's the deal. If you want to get real results with AI, like game-changing results, then you can't just use ChatGPT the same old way as everybody else. And don't get me wrong, ChatGPT is great, but instead of using it as another tool, like a cool way to save yourself a little bit of time, what we do is train ChatGPT to actually go to work for you, generating leads, booking appointments, servicing clients 24 hours a day, 7 days a week. Just imagine having ChatGPT working for you and doing it with absolutely zero technical skills. And heck, you don't even need any previous business experience to do this. But rather than just tell you about it, because I know talk is cheap, I want you to see this with your own eyes. And when you click on that button, I'm not only going to teach you how all this works, I'm going to take you behind the scenes. We're going to pull back the curtain, go step by step, and by the time we get done, you'll not only know more about AI than 99% of the people out there, you'll know exactly what you need to do to take ChatGPT and turn it into a well-oiled sales machine. But you got to take the first step. Click on that button. It's absolutely free. And hey, look, feel free to come as a skeptic. I know there's a lot of guys on here telling you all about their magic money machines. And while I'll never say that this is easy, business is never easy, I will tell you that if you sleep on this one, you're going to kick yourself in the pants later. You already know that AI is the biggest thing to come around since probably the internet. And you just need to know exactly what you got to do to actually capitalize on that. So click on that button and let's get to work, and I will see you on the training.
I'm going to show you a way to potentially make money by pairing Amazon with the power of AI without ever selling physical products. And I promise you've never heard about this before. I just created some simple digital products, then I put them up on Amazon. And it was so exciting. The first time I tried it, I made $14. And I was like, oh my goodness, this actually works.
Literally, you're making money while you sleep. So it's like I go to sleep and I wake up the next morning and I already have like $30, $40 that have already been made. And I'm just like, that is so cool.
We're going to Mexico and I'm paying my bills. I have extra money in the bank. I have nice savings. I work probably about 5 hours a week.
Hi, I'm Carla Marie, and the coolest part is Amazon puts over 300 million customers just a click away. So age, experience, qualifications, none of it matters. I want to share my full system with you, but obviously bills and help you enjoy more fun trips. Don't wait. Click anywhere around this video and watch the free workshop now. Discover how we create reliable streams of semi-passive income without complex websites, unneeded stress, or huge startup costs. You'll even get 3 valuable bonuses just for watching. We've designed these bonuses to help you succeed with this as fast as possible.
We made our first $100 online and now $1,000.
I can't promise this training will be free forever. So watch it now. Could this be the stepping stone you need to start living the kind of life you've only dreamed of? There's only one way to find out. So click now, watch the training, claim your bonuses. You'll be glad you did. I'll see you on the other side.
Dr. Liz here, checking in. Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today's topic, peanuts. The peanut is sweet in flavor, it's neutral in temperature constitutionally, and it moistens the lung. It harmonizes the stomach, stops bleeding, and it treats a dry cough. Very helpful. It helps with nausea and scanty lactation. So new moms looking to nurse effectively, buddy up with the peanut. It goes to the lung organ system as well as the spleen organ system. It's nicknamed in the Tao the longevity nut or the botanical meat. The peanut. It contains 50% oil and it's twice as much as soybeans. It has rich, unsaturated fatty acid in the peanut, vitamin E, and more than 20 kinds of different nutrients and vitamins. It's good for the brain. Peanuts are really good for the brain. You do need to cook peanuts because raw peanuts are toxic. Modern day science. Good source of fiber, aids in digestion, and excellent source of biotin. Today's topic was the peanut. Please like and subscribe to our channel down below, where life becomes better living, and jusqu'à demain. Good morning, Dr. Liz here, Doctor of Acupuncture and Oriental Medicine. Checking in, where life becomes better living. Today's topic, the walnut. Walnut. Nicknamed long life nut. In ancient Russia, it was called the food of the strong men. It's sweet in flavor. Its temperature is warm constitutionally, and the walnut can help treat frequent urination. Impotence. It goes and strengthens and nourishes the kidney meridian pathway organ system, along with the large intestine organ system and the lung. It can strengthen, as I mentioned, the kidney. So the walnut is really good for the kidney. It's really good for the brain, and it's really good for the liver too. So in modern day science, the walnut is rich in omega-3. It has anti-inflammatory properties. It promotes gut health, and it promotes weight loss. lowers blood pressure. The walnut. Thanks so much for checking in today with Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Please like and subscribe to our channel so we can keep these wellness tips coming your way. Jusque demain. Hey, good afternoon. Dr. Liz Perry here. Just wanted to let you guys know the great news. My book is finally available for pre-order on Amazon. It is called Live Longer, Eat Better by Dr. E.A. Perry. And it is a book with 3 different sections all about food therapy. Section 1 is 36 foods for long life based on the Tao. It was compiled extensively by scholarly workers over the decades, and I am just reporting that information. It's not my opinion, it's scholarly academic resource work compiled. And anyways, so it's 36 foods for long life is section number 1. Section number 2 is a personalized quiz that you all can take to find out which part of which meridian pathway might potentially be a little bit off on your own body system, and how can you correct it? What kind of food therapies can you indulge in that are delicious and yummy that will get your body back in balance? Although, side note, it is optimal to meet with a TCM doctor or acupuncturist to make sure, formalize it. But that's section 2 in the book, Live Longer, Eat Better by Dr. E.A. Perry. And the third and final section is about Ask Dr. Liz articles that are based on more modern science, meta-analyses from predominantly the Bethesda Library on different foods and food therapies and what they've clinically been proven to do. So enjoy the book, guys. You can go on Amazon now and pre-order that. It is by Dr. E.A. Perry, and the title of the book is Live Longer, Eat Better. It's a paperback, it's a reference book, and there's pictures in it. Enjoy. Hi guys, Dr. Liz here. Just reaching out and wanted to say hi. I'm just starting to do my channel and new videos on YouTube. I'm super new to this. I'm 58 years old, so I'm a little bit new to learning all about this kind of thing. So I welcome any and all feedback. But I am a doctor of acupuncture and oriental medicine, and here's my background. I am a mom. I was a really young mom, so I didn't get to go to medical school till I was a little bit older. I'm now a grandmother and a super happy one. But I have been in the healthcare field for over 30 years, from leadership and development to executive search to data analytics, and I am a doctor, practicing physician with my own private practice in Stuart, Florida. So I'm all about trying to provide wellness to people and helpful, useful information, not just through me, but through your resources locally. So anyway, I need your help, guys, because like I said, I'm a little bit older, but I'm putting myself out there trying to help you. So if you can help me help you, I'll give you the information you need to live the best life that I can contribute to. Okay, so I just did a YouTube video on headaches, but I did want you to know my background. Also, I've traveled around the world multiple times
spent a lot of time in the Far East, all throughout Europe, the Middle East, all over North America, and South America. So in the 50 states of the United States, so forth. So I'm a very well-versed, worldly person, a journalist. I have a new book coming out called Live Longer, Eat Better, and I'll let you guys all know when that comes out. But that's a little bit about my background. I did go to Harvard. I have a master's degree in management from Harvard with a heavy emphasis and focus on healthcare leadership. So I know it's a little bit of a diverse background, but it is 30 years plus in the healthcare field. So how can I be of assistance? What do you guys want to know about? Pressure points, herbal remedies, who to go see, how to identify the acupuncturist that's most suitable for you. You just let me know, because I am here to share information to be most useful for you guys. Thanks so much.
Good morning, Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today's topic, depression. A little bit about depression and anxiety today. So almost 10% of Americans seem to suffer from some type of anxiety or depression. More girls than boys, over 10% for the girls, and over 6% for the boys. So a lot of people are taking antidepressants. And this is why we're going to talk a little bit today about that. So yes, antidepressants are drugs that act on specific brain chemicals, which are supposed to regulate your mood, and commonly they do. Commonly prescribed medication in the U.S., according to the American Psychology Association, is first being analgesics, which helps deal with pain, typically, historically. And the other types of antidepressants that are commonly used are SSRIs, SNRIs, and DRIs, tricyclics, and MAOIs, to name a few of the common ones used and prescribed to many, many of these 22 plus million people here in the United States of America. So, wow, sounds like a foreign language, people say to me. Got that. So please tell me about the most common type of antidepressant. So sure, I bet you've heard of Prozac, and Prozac is an example of an SSRI, and which stands for selective serotonin reuptake inhibitor. And Prozac and Zoloft are examples of such, and they work by increasing the levels of the serotonin in the brain, which is a neurotransmitter, which is made of protein. So the brain making more serotonin available is the function of those particular SSRIs. So an SNRI example would be like Cymbalta. And the SNRI involves norepinephrine, and is related to alertness and energy, and SNRIs work in the sense that they block the neurotransmitters. That's what they do. That is their function. The SNRI blocks it. It blocks specifically the serotonin and the norepinephrine from going back into the cells that release them. So that's what their function is, ladies and gentlemen. Wellbutrin is an example of an NDRI, and NDRIs are another choice if you're depressed or have anxiety, and they involve the dopamine and the norepinephrine. Dopamine and the norepinephrine are involved when you're taking an NDRI, such as Wellbutrin. These are fairly common ones that I'm mentioning here today, just touching the surface. Tricyclics and MAOIs are not any longer commonly used due to some of the potential dangers that patients were experiencing, and which included side effects and plus interactions with other types of medications. It's happening too commonly, So they nip that in the butt for the most part. So people ask me, do antidepressants even work? And the question is, studies show that pertaining to mild to moderate depression, they do work, but only as effectively as a placebo. And placebos do work. But for someone with an extreme condition of depression, antidepressants are found to be effective. But if you're one of these people that's sort of borderline mild to moderate, exercise can be helpful for you too. And mild to moderate depression and eating fruits and vegetables really does matter. Or rainbow type of diet. That's why I wore this just for you guys today. Rainbow foods, grapes, kelp, greens, all kinds of delicious balanced diet with lots and loads of antioxidants, good for the brain. So I don't actually recommend eating fish for depression, but lots of fresh, organic fruits and vegetables, rich beans that contain a lot of folate, loads of greens cooked in your soups, at your Thai restaurants, or however you want to cook it in your kitchen. So the mercury content in the fish is why it could possibly be not overly positive with mental health disorders. So if you know it's fresh and it's been tested, then I think it's fine. But generally, mercury, more and more mercury is being found in the fish, so I would try not to eat too much of that if you have a struggle with a mental health issue, because the mercury is found to not be positive with folks that struggle from depression. So basically, studies show that if you suffer from mild to moderate depression, you're better off exercising. Even just take a walk. Take a walk in the park. Look at the greenery around you, how lovely it is. Green stuff is good for the liver, and it helps move the chi in our body, which helps us become less sad. It's healthier for you than even walking the beach. But you can do both. You can do both. And also, you eating really healthy, exercising, surrounding yourself with nice, green, beautiful things, eating a balanced diet with all different colors in it, orange and yellows, greens, and fruits and vegetables that are rainbow-like, really healthy for the brain, and peanuts, and all kinds of yummy things, nuts and seeds. The other thing that you can do is talk to someone, and acupuncture. Did you know acupuncture is extremely useful and helpful for a lot of mental health conditions, including anxiety, depression, even PTSD. We use the ear. See the ear, folks? We do auricular medicine on that. Helps very anxious people. Oh my gosh, does it work well. So there are some ideas, and also an anti-inflammatory diet. Yep, it's another good choice, which is kind of the items that we already mentioned. But exercise, walking around, surrounding yourself with nice green surroundings, eating like a rainbow vegetable diet, thinking happy thoughts, go talk with someone, and getting acupuncture and auricular therapy. Thanks for checking in. Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Jusqu'à demain.
Good morning, Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today's topic, we are going to talk about 3 different fruits and how much fiber they each contain and why we need fiber and how it helps. So first, the 3 fruits are avocado, number 1. Number 2, the banana, And number 3 is the eggplant. Now, which fruit do you think has the highest amount of fiber? Good guess. So actually, the avocado is the winner. It has 10 grams of fiber for a medium-sized avocado. The banana has only 2, but if you eat it all green, it has 3 grams of fiber, which is still substantial. And the eggplant has 2.5 per cup of cubed, chopped up eggplant. So they're all really super good choices, and they're all fruits, whether we knew that or not. Today's lesson. And why is fiber important? Fiber is important because if we don't have enough fiber, we don't have enough energy. Fiber helps us go to the bathroom comfortably and regulates us. It also helps lessen insulin spikes and regulates blood sugar as well as cholesterol, lowering it. So that's why fiber is important, if you didn't already know exactly as to why. So anyway, the avocado is a winner. It does lower, not only have the most amount of fiber of these 3 fruits, but it also lowers our LDL, which is the bad cholesterol, and all LDL is bad cholesterol. So it's really an important one to include in our regular choice of foods. We're going to be doing a challenge real soon, so guys, checking in. And it also does, it's just, so that avocado is the winner of the fiber. It's also high in many other nutrients, but we'll just leave it at that for today. Check in later when we're going to be doing some more interesting, exciting things like a 21-day challenge. And I'll explain that more to you soon. So again, today's topic was fiber, about the avocado, the green banana, and the eggplant. Avocado being the winner with 10 grams of fiber for 1 medium-sized avocado. Thanks again, Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life does become better living. And please like and subscribe. Keep these wellness tips coming your way. And jusqu'à demain. Dr. Liz here, check it in. Doctor of Acupuncture and Oriental Wellness. Today's topic, grapes, where life becomes better living. Please like and subscribe to our channel, and let's talk about grapes. So grapes constitutionally have a sweet and a little slightly sour flavor. They are neutral in nature in terms of temperature, and they strengthen the ligaments, the tendons, the bones, and they treat heart palpitations. So if anyone's getting real excited out there, you can eat some grapes. They will lessen your heart palpitations. Grapes help eliminate night sweats or lessen the condition. They also help treat edema. Yes, folks, grapes help treat edema. And they also disinhibit urine, so they can help improve a condition of a UTI. Grapes are known as a good tonic and a good blood tonic to help improve the health and vitality of our red blood cells. They help with a weak stomach and spleen, and they tonify all sorts of different deficiency that we may or may not have. They're also are a diuretic, and they help get rid of dampness, so good for weight loss. They also boost immunity, promote sleep, improve heart health, protect our eyes. They improve hydration. They help against insulin resistance, and they even resist brain health reduction, so they can help improve the condition of our brain, and specifically memory. They're good for bone health, and they're known as a natural anti-aging agent. Make it a great day, folks. Again, Dr. Liz, Doctor of Acupuncture and Oriental Medicine, with my new book out, Live Longer, Eat Better, where life becomes better living. 36 Foods for Long Life, and the grapes are number 16. Jusque demain. Hey there, Dr. Liz, Doctor of Acupuncture and Oriental Medicine, checking in, where life becomes better living. We're going to talk today about Frank's sign. Frank's sign is a crevice or a crease in your ear that starts in the tragus and goes across the lobule back to the backside of the auricle. And Frank's sign can be an early sign or indication of coronary heart disease. It can also be a warning sign of diabetes, other types of heart disease, and or cerebral problems such as an infarction. However, some of the more recent studies are really further supporting more dominance in the coronary heart disease, which is typically the coronary arteries in our human body that gets clogged from plaque. And it's not just from cholesterol, but the triglycerides and the bad cholesterol pushing the toxins and the fats into the wall of the coronary arteries. So how do we prevent? Subscribe to my channel, Ask Dr. Liz, and follow the foods. Please subscribe and like the foods that lower your cholesterol naturally. So if you can possibly steer clear of a statin, you may have to take one, which will, of course, lower your cholesterol. But also, food therapy can be effective as well alongside of the Western medications. And plug in again to Ask Dr. Liz to get a list of the food therapies that can help lower your cholesterol to lessen your likelihood of America's biggest killer, coronary heart disease. Thanks for checking in. Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. And jusque demain. Hey, checking in. Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today we're going to talk about our kidney and what it means in traditional Chinese medicine. So the kidney is a very important visceral organ. They're both located that if we put our hands on our waist and we face our fingers backwards, their palm of our hand is pretty much close to covering up underneath us our kidneys. So kidneys in traditional Chinese medicine are very important for long life. And when we have disease orientation within our kidney or the organ system, we might have symptoms like we're losing hair. We have possible night sweats. We have a situation maybe where you're starting to get osteopenia or osteoporosis. So yeah, bone health is in fact absolutely related to the health of the kidney and its organ system in traditional Chinese medical theory. And so when we nourish our kidney, when good, healthy nutritional foods that go to the kidney, guess what? Our hair grows better, our bones get stronger, our brain is better because the kidney also nourishes our brain through the brain marrow, which is made in the long bones, all ruled and dominated according to traditional Chinese medical theory here at TCM Tidbits by the kidney. Thanks so much for checking in. Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. So please subscribe down below so we keep these wellness tips coming your way. Jusque demain. Hi, I'm Dr. Liz Perry, Doctor of Acupuncture and Oriental Medicine. I spent over 30 years nationally and worldwide studying best practices from around the world, from a data analytical perspective and from private practice. The top 5 reasons people come to my clinic are as follows: headache, anxiety, GI problems, women's health. Headaches are commonly seen in clinical practice, and that's what we're going to talk about today. The entire head in a headache can be affected, or it may be localized to the frontal, temporal, occipital, or vertex area. Pain in the head results, in Chinese medicine, from an inadequate amount of qi, blood, or essence being able to get to the head, and or an obstruction of the clear yang. Headache can be from a cold or it can be an internal problem. And it can be caused from migraine, hypertension, sinusitis, trigeminal neuralgia, meningitis, or a head injury. Commonly, acupuncture and herbal medications, if prescribed properly by your practitioner, can improve the condition and in many cases resolve the condition. We identify not only the root cause of the headache, but the location and organ system involved in your particular headache system. So there's usually 5 of those we refer to in terms of the location of the headaches in TCM, or traditional Chinese medicine. And that would include the taiyang, which is pain at the back of the head, known as the occiput, or the upper back and the neck going into the head. The Yangming headache, which is the forehead, pain in the forehead, predominantly. And the Shaiyang headache, which is either one-sided headache or both sides of the head. And that is usually, like I said, on the side of the head, and it's called Shaiyang, the temporal region. Joyen headache is a pain at the top of the head, or the vertex of the head, and it can sometimes go into the back of the eye or somewhere within the eye area. And the Shaiyun headache, which would be the 5th one, is a headache radiating to the cheeks and the teeth in many cases. So I encourage you all to locate if you suffer from headaches of any type. Obviously, if your medical doctor is already evaluated and isn't able to substantially help, I encourage you to locate an acupuncturist or doctor of acupuncture and oriental medicine in your area to help you with your headache resolve. And you can reach me at drlizperry@gmail.com or text at 772-261-8358. And thanks so much for promoting our channel, and happy health.
Good afternoon. Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. And the proud author of Live Longer and Eat Better, that contains 36 foods for long life, now available on Amazon, as well as at Barnes & Noble stores for order, and online with the Kindle. Today's topic is going to be on tongue diagnosis. Now, most of us humans have a tongue, and the tongue has been used for thousands of years in ancient medical wisdom to help diagnose accurately an individual's pathologies. And so the tongue, I can show you right here, has in the front of the tongue is the heart and the lungs, according to most tongue grafts. The sides of the tongues, this is just somebody's sample tongue graft, but the sides of the tongue, this is very atypical, very standardized in our textbooks, is a side of liver and gallbladder. The back of the tongue typically represents the health and vitality of the intestines and the kidney. And the middle of the tongue often is representative of our digestive tract, such as the pancreas, the spleen, and the stomach. So, how does this help? Well, it can help a lot. So what happens is we could be looking at a patient, and if the tip of their tongue is really red, then we're going to notice that they have a lot of heat
in either their heart or their lungs. What does that mean? So that means that meridian pathway, the heart organ system, or the lung organ system, or the actual organ itself has too much excess. So that person might have anything from anxiety to elevated blood pressure to palpitations to vivid dreams to excess sadness because of a traumatic death of someone they loved. It could be all kinds of emotional, physical, viable, calculable, reportable, evidential things going on with this person along those lines. So a red tip of a tongue would be indicative of that. Or they could just be a student, studying so much they're just anxious from so much studying. So there's a wide variety of causes, but the point being is the tongue is a framework that's extremely accurate in giving more than a high-level overview of diagnostics. So a normal, healthy tongue is sort of like a pinkish reddish color, and it does not typically have any fissures in it or crackles in it or cracks in it. Just a fairly thin, non-swollen bodied tongue that looks a little bit like this here. Now, as you can see, people have very many different types of tongues, okay? And that is just a couple. So when people do have a slippery tongue, a lot of extra fluid in their mouth, that's indicative a lot of times they may be really tired. Would be a question we would ask based on our training as acupuncture physicians. They may have a crack or the tongue might be very, very pale, like this one. See how that tongue there is like very swollen and sort of pale? This one's much darker and it has a thin line in the middle. Now, there's other tongues that show a lot of teeth marks in them. That's indicative of a weaker digestive system. If the tongue is swollen, there's a lot of teeth marks. That person commonly is tired and they have digestive issues, maybe bloating, so forth. Then there's people that have tongues like this with a big, pretty thick crevice or fissure all the way to the end. That's commonly indicative of a problem with the heart. It goes all the way to the end. It's a warning sign and or a confirmation of a heart pathology. So the beauty of this medicine and tongue diagnosis is it can provide a warning sign and or a treatment methodology as part of our diagnostic system. So Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, checking in where life becomes better living, and just informing you folks, providing TCM tidbits so we can all take a look at our tongue and keep an eye on that. Take a trip to our acupuncturist or our doctor of acupuncture and oriental medicine in your area so you can get a tongue and pulse evaluation and a treatment plan to help you live optimally. Make it a great day. Dr. Liz and Jusqu'au Domaine. Hey, good afternoon. Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, checking in. Wanted to share an interesting pressure point with you guys today. If you're ever out and about, at the beach, at a party, home with older grandparents or parents, even a small child, and somebody loses consciousness, faints, we call it syncope. So whatever the case or cause may be, or even if they've had a seizure, I'm going to teach you a pressure point. It's called Renjong or Do 26, and it works amazingly well. Yes, you still call 911, but it's going to take those guys a little while to get to you. So in the meanwhile, 1/3 of the way down the filter, right here. Take your fingernail, even if you're a guy, just use that fingernail and press. And that typically will revive a person out of a loss of consciousness, even in some cases a coma and a seizure. So very, very useful point in trauma, and just great to know when we're out and about living life. You just never know when you're going to use it. You could just gently push on that until that person comes to be. And even if they don't come to be, which likely they will, it will lessen any likelihood of brain damage. And there's lots of clinical science to support exactly what I'm saying to be very true. So hope that helps. Do 26 Renjong if anybody loses consciousness for whatever reason. Heat stroke, heart attack, just a fainting while you're waiting for the first responders. Okay? If you have any questions, let me know. Make it a great day where life becomes living better. Bye now.
Hey, Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today's topic, the carrot. The carrot is wonderful for our eyes. It's a root vegetable, as we all know, the carrot is, and it's loaded with fiber, rich in vitamin K, and has a fair amount of abundance of antioxidants, the carrot does. From a Chinese medical perspective, it's sweet and acrid in its flavor, its natural flavor, and its temperature constitutionally is neutral to slightly warm to warm. It goes to the lung, the spleen, the stomach, and the pancreas, organs and organ system pathways. It treats cough, indigestion, and it's really good for loose stool. The carrot's really good for loose stool, dysentery, diarrhea, and even constipation. Carrot is a wonderful root vegetable that we should all be consuming. It also helps treat nausea, GERD, hiccups, and any type of chi flow that's going in the wrong direction. It helps people with a poor appetite. It's loaded in vitamin A, high in iron. Modern science further explains that it's loaded in calcium, phosphorus, potassium, and ascorbic acid. The carrot. Carrots are a great choice for cancer prevention. If you've been a smoker or if you're a smoker today, consume the carrots. It is shown clinically and scientifically proven to help prevent or treat or lessen the likelihood of cancer in those patients that have been smokers or exposed to smoke orientation. The carrot can help. It lowers our blood cholesterol. It is great. If you consume the carrot, it can improve your energy if you suffer from fatigue. And they're great for your eyes. Carrots are. However, you do need to cook carrots to get the most out of their cancer protection. Why is that? Because by cooking the carrots, it releases 2 to 5 times, that's right, 2 to 5 times more of the carotene than eating a raw carrot. Thanks so much for checking in. Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where today's topic was the carrot. Please feel free to like and subscribe if you find these wellness tips useful. And jusqu'à demain. Did you know that certain lifestyle choices can impact your chances for developing cancer? My channel is all about health, wellness, and the quality of life, because I believe that by combining best practices from around the world optimizes healthy living. I'm Dr. Liz Perry, and I'd like to introduce the concept of holistic cancer prevention and its significance in the modern healthcare world. Cancer is now the #2 killer in the United States,
and in the world, second only to heart disease. So if modern medicine plans to respectably maintain its posture in effectively treating cancer, the data is not supportive, with nearly 2 million new cases in 2023 and approximately 610,000 cancer deaths in 2023, according to the National Institute of Health. Cancer rates are on the rise. We have some work to do. Perhaps holistic cancer prevention is needed, become more significant. Although modern science continues to significantly invest money and time into cancer research, there are limitations of traditional cancer treatments, and the importance of prevention in reducing the global burden of cancer must become a greater priority. Traditional cancer treatments primarily include surgery, chemotherapy, and radiation. These protocols by themselves don't seem to be working anywhere near as well as we'd like them to be working. Top 3 cancers in the world right now are lung cancer, breast cancer, and colorectal cancer, followed by prostate cancer and stomach cancer and liver cancer, while cervical, uterine, esophageal, thyroid, and bladder cancers all still make it into the top 10 cancers, according to the World Cancer Research Fund International. And then we still see a lot of cases in non-Hodgkin's lymphoma, pancreatic cancer, leukemia, kidney cancer, and brain cancer. The World Cancer Research Fund International concurs that lifestyle choices can make an enormous impact on people's likelihood of developing cancer. Their panel of experts suggests a variety of initiatives that we will delve into further in the next section. For now, let's take a quick look at some first world countries with lower cancer rates than us, such as Japan, Finland, Switzerland, and Singapore, and see what they are doing to lower cancer rates and work to prevent cancer growth in their country. Well, let's take a look in Japan. They eat a lot of vegetables and drink a fair amount of green tea, a #1 anti-cancer food. Finland uses a variety of various preventative techniques. Switzerland offers easy access to high-quality healthcare facilities while encouraging cancer prevention programs and a healthy lifestyle. Singapore has recently lowered their cancer rates through public education and the use of early detection initiatives. Regarding exploration and development, I will delve into various holistic approaches to cancer prevention, such as diet, exercise, stress management, and environmental factors. Diet is at the top of the list, and for good reason. What we eat has a huge impact on our body's ability to adapt to change. We will have control over our diet, so this is a fantastic place to start in our own cancer prevention plan of action. Here are some helpful cancer preventative dietary suggestions. #1, limit fast foods. 2, limit sugary drinks such as sodas. Number 3, limit red meat or any processed meat. Number 4, limit alcohol consumption. And according to the World Cancer Research Fund, they suggest you not use supplements for cancer prevention. Number 6, avoid aspartame and processed foods of any sort. On the up note, foods that we do want to indulge in for cancer prevention tactics and strategies include asparagus, bamboo shoots, berries, cucumbers, garlic, ginger, hawthorn, kelp, lotus seeds and mushrooms, onions, radishes and sweet potatoes. Consume plenty of leafy greens. And for smoking-related cancers and best practices in preventing smoking-related cancers include apples and carrots. But be sure to cook the carrots in order to optimize the cancer protective qualities of the carotene within the carrot and eliminate bacteria that can be found in raw, uncooked foods. Avoid smoking, exposure to secondhand smoke, and avoid exposure to excess sunlight. Exercise, walks in nature, Tai Chi, Qigong, and yoga are all good choices. Mindfulness practice and quality of sleep. Environmental factors should also be considered and looked after, such as quality of air and water, especially in our homes. Other lifestyle choices that may further help prevent cancer includes breastfeeding your baby and maintaining a healthy body weight. The long life veteran in the Western world, be it Western Europe or North America, is a person that eats daily, long life, nutritious foods, commonly found in this book, Live Longer, Eat Better. They have a life purpose and they stay active. These centenarians are typically positive thinkers, have strong family ties, have a positive work ethic, and have a relationship with religion or some higher power, and they stay close to nature. They stay active, and they spend much of their time out of doors. I'll summarize now some of the key takeaways from today's video and the importance of adopting these holistic approaches in our journey toward cancer prevention. Number 1, diet is extremely important in cancer prevention. Load up on fresh foods, fresh vegetables, legumes, seeds, and nuts. Eat plenty of fiber and learn your anti-cancer foods. Number 2, don't smoke. If you do smoke, reach out, get the support that you need, and find a way to quit smoking. Number 3, stay active. Exercise daily, preferably while communing with nature, such as walks in the park, Tai Chi or Qigong at sunrise, or yoga on the beach. Number 4, look into air and water filtration systems for your home. Have them installed to improve the safety and cleanliness of your immediate environment. Number 5, meditate and spend time once again with nature to modify stress. This type of mindful practice is not only useful for cancer prevention, but will likely improve your quality of sleep. Number 6, develop a relationship with an acupuncturist. They likely will be a wealth of knowledge in cancer prevention through the use of acupuncture, custom therapeutics, and the use of herbs, as well as food therapy and Qigong meditative practice. Definitely worth exploring. And number 7 is our call to action. I encourage you to explore more videos on holistic health. Share your thoughts on cancer prevention, strategies, and subscribe here for future updates. Are you aware of the true cost of stress on your health and your finances? I'd like to introduce you to the concept of holistic stress management and its benefits for overall well-being. I'm Dr. Liz Perry, and my channel is all about health, wellness, and the quality of life, because I believe that by combining best practices from around the world, we optimize healthy living. Let's highlight some of the common stressors in modern day life and their common impact on mental and physical health and well-being. The challenges of day-to-day living, they encompass predictable challenges as well as unexpected ones. These stressors can vary from our daily commute to a sick child, an auto repair, an argument with a spouse, broken appliance, an ill pet, a divorce, or even a death of a loved one. Or it even could be our own mental and physical health concerns. That holistic stress management programs are in fact shown to effectively reduce stress, reduce anxiety, improve a depression, and improve overall well-being by creating greater awareness of our thoughts and behavior and the triggers involved in creating our behavior, and ultimately getting us to being able to accept responsibility for our own well-being and become willing to take charge of our own self-health. Yes, exploration and development of holistic stress management techniques include spending time with nature and being mindfulness, making healthy and wise and well thought out personal choices, and time management, wisely managing our own time, personally and professionally, as well as healthy eating, exercise, such as Tai Chi, yoga, Qigong, and you get an A+ for acupuncture. I'm going to share 6 tips and techniques with you now, and let's make this so it is easy for you to remember this. Think about your needs, Needs. N is for nature, E is for eat well, the second E for exercise, D is for drinking plenty of water, S is for sleep well, and an A+ for acupuncture. Firstly, nature, in order to effectively manage stress, spending time with nature is key. In fact, it is far more essential than we may even realize. Taking time daily to commune and harmonize with nature and our everyday surroundings in nature makes a world of difference. How do we take steps to do this? First, try awakening primed to the sunrise each morning. Prepare to be outdoors at sunrise each day if possible. Studies show, and the ancients know, that this daily experience balances or helps to balance our biorhythms, which in turn creates mindfulness, and further by doing so, we feel more alive and spirited, and our mood improves. It helps regulate our breathing, improves our mood, and improves our quality of sleep. I find that by rising with the sun and harmonizing with the nature, it is like a launching pad to a vital, well-balanced life. So simple, but you gotta do it. We often begin to have greater self-respect for ourselves as well as others when we do this practice. We gain greater clarity within ourselves about what we want and what we really need, and enjoy healthier relationships as a result. These aspects tend to commonly fall into place when this technique is practiced daily. We become more mindful from simply spending time with nature. The natural flow of your life becomes that much easier. Secondly, eat, and eat well. As Hippocrates so wisely stated, and I quote, "Let food be thy medicine, and medicine be thy food," end quote. Some foods which are shown to counteract stress include the consumption of almonds, banana, berries, celery, cucumber, green tea, spinach, turmeric, walnuts, and watermelon. And here are some foods that you may want to avoid if you are looking to moderate stress. Stay away from the red meat, stay away from the sandwich meats, and stay away from any and all animal protein. According to the National Institute of Health, adult women who consume too high of an intake of animal protein are more likely to show symptoms of not only depression, but anxiety, suicide, and stress. Interestingly, adult women who consume strictly plant protein had no association with these disorders relationally. Thirdly, exercise. Exercise does not need to be excessive. It is important, however, that you do move each and every day. May a simple walk with nature give you more than what you seek. Number 4, drink. And drink water. Room temperature water is the most suitable, the healthiest for us, and plenty of it. Water's role in the brain is to balance neurotransmitters such as serotonin and dopamine, which regulate our mood. Proper hydration is critical for feeling happy and staying motivated. And it is particularly hot out, or if and when it is particularly hot outdoors, or if you do feel like you've been dehydrated or you're dehydrating, a higher quality water with a higher pH is commonly recommended to optimally hydrate your whole body system as well as your visceral organs. Adequate hydration helps us to maintain and moderate our blood sugar, which is also important for managing stress. Maintaining adequate hydration can keep us feeling happy and becoming or staying more motivated. Fifthly is sleep. Sleep is so important. Do you pay attention to what time do you go to bed at night?
And then actually what time, once you've gone to bed at night, what time do you actually fall asleep? Do you wake up at all during the night? Because maybe you've had a dream, or do you have to just go to the bathroom? If so, do you take a note about what time you actually are waking up? And once you get back into the bed, if you've left the bed, are you able to fall back to sleep quickly? Do you have dreams? And if so, do you remember your dreams? Be sure to tell your acupuncturist about your sleep patterns. This is a big part of strategically overcoming stress, is becoming a better quality sleeper. And for the optimal sleep, rise and shine with the sun and stick to a daily and nightly routine. Sleep allows our body to cleanse and rejuvenate while it rests, which can help balance our mood. When we are well rested, we are better equipped to handle stress without becoming overwhelmed. Last but not least, number 6, A+ for acupuncture. Go get acupuncture. Shop around, find somebody you are the most comfortable with explaining your problems to and seeking treatment from. It is one of the most effective modalities used in stress management. Many companies, large corporations now bring in acupuncturists on site to help employees eliminate stress and improve on-the-job performance. It's almost as if wellness is quickly becoming the new leadership and development program for corporations. Healthy lifestyle choices like these are easy and effective options for overcoming stress and to incorporate into your stress management program. Let's now put a pencil to paper. So if saving the $10,000 annually isn't already enough, you are likely to not only save the money, but to feel healthier and happier with a lot more pocket change. Let's take a quick look at the 3 top stress-induced diseases in the United States: GERD, hypertension, and addiction. Yes, stress can be a heartburn trigger when too many things pile up at work, school, or home, or you experience a big life change. Heartburn symptoms may fire up or worsen. Stress may also be connected to the condition that causes the heartburn: acid reflux and the gastroesophageal reflux disease. The cost burden of GERD is substantial. GERD patients had a total of $13,331 expenditure annually for the average person that had GERD. Now, healthcare cost was even higher for the patients who suffered from GERD, typically due to stress, who required surgical procedure. Compared to the patients without the surgery, their bills ran up to $40,772 on average, and some as high as nearly $100,000, helping them cope and deal with GERD. Commonly, once again, developed from stress. Developing number 2, hypertension from prolonged stress is common and is also a significant risk factor for both a heart attack and a stroke, and a major cause of premature death. Cardiovascular disease is our number 1 killer in America. There is no price on this one because the average annual healthcare cost for a person with major issues with the heart, unfortunately, they don't live to see and or pay the bill. And if they do, it far exceeds that $10,000. I can promise you that. Depression. Average person that suffers from depression, $10,000, $836 annually. Let's be clear, that doesn't even account for the anxiety and the addiction component of expenditure financially. Your savings are insurmountable by taking action. Let's just quickly summarize the key holistic management techniques discussed and emphasize their importance for a balanced and more balanced lifestyle. Number 1, spend more time outdoors, communing with nature, preferably at sunrise. This regulates our biorhythm. At sunset, we should be winding down and preparing for bed. Number 2, eat loads of delicious, nutritious, plant-based foods, preferably cooked. Number 3, exercise daily. Yoga, a walk in the park, Tai Chi, Qigong, or going to the gym. All good choices to keep the circulation of our blood and oxygen moving throughout our human body. If you can't get to exercise, get to the acupuncturist. Number 4, drinking water, quality water, and a good amount of it. Number 5 is sleep. Try to get at least 8 hours of sleep per night. Create a regulated sleep-wake routine. And again, if you're having trouble with the sleep, harmonize with the nature at sunrise and see how your sleep will quickly, very likely, improve its quality. Last but not least, number 6, again, is the A+ for acupuncture. Go get acupuncture. You're likely to find yourself healthier, happier, and in a lot better mood. I encourage you to further explore other holistic health videos that support stress reduction, anxiety, depression, and addiction. Please like and subscribe if you do feel that you've received any benefit from our video. And feel free to check back so that we can give you some updates, and feel free to share your experience in the comments section below. Dr. Liz Perry and Je suis Domaine. I'm Dr. Liz Perry, and today's topic, green tea. That's right. Green tea and green tea. It originates in China, and actually it was interestingly discovered in 2737 BC by an emperor in China at the time known as Shannon. And it was given to him by accident when he had requested a cup of warm water, that a green tea leaf had been mistakenly boiled in his cup of water. He found it vital and refreshing, and thus it became a new beverage discovery with lots of amazing benefits. The green tea. Shall we continue? It is cooling by nature constitutionally, so it's an excellent choice to drink if you're going out in the summertime heat to play golf or tennis, or just to meander to the shops and it's extremely hot. Green tea can help you experience a nice cooling to your blood. It's bitter by nature in its flavor, and it helps improve the condition in many cases of your heart and your liver. In the Far East, particularly in China, it is custom to drink green tea to help optimize digestion and moderate our body weight. Green tea is an excellent choice for a preventative for cancer. Green tea. Many
scholars will argue that it is the number one anti-cancer food on the planet. Green tea has amazing benefits. It is also known, according to traditional Chinese medical theory, to dissipate the phlegm in our body, which often is accumulated in our body from consumption of gluten and dairy items. And over time, that can create what we call phlegm, calcification. And that is, according to traditional Chinese medical theory, the primary cause of most cancers, phlegm. And guess what? One of the benefits of consuming the green tea is, you got that right, it helps to dissipate phlegm, which is a primary cause of most tumors. And it does go to the liver and the heart. So, that's our topic today, was green tea. Originated itself in China, and I am Dr. Liz Perry. My channel is all about health, wellness, and quality of life, because I believe that by combining best practices from around the world, we optimize healthy living. Thanks so much for checking in. Dr. Liz, where life does become better living. And if you like these videos, please feel free to like and subscribe to our channel, so we will keep these wellness tips coming your way. Jusqu'à demain. Good morning, Dr. Liz checking in, Doctor of Acupuncture and Oriental Medicine. Today's topic, the radish, where life becomes better living. The radish is an anti-cancer food. It was one of the 36 long life foods of the people of the Tao. It's also had a nickname called the red turnip due to its color. And that was also another nickname they called it, was petty ginseng. So it was listed as the vegetable of the nation by the Dutch, and the Japanese considered it, the radish, as a major contributor to why their nation people have long life. They consume a lot of radishes. Its flavor is acrid and sweet. It's cool constitutionally, and it clears heat. So it also is great for cough, phlegm, diabetes, bloating, migraines, and nosebleeds. The radish. It is very good for digestion. It dissolves food stagnation, so again, digestion in that capacity as well. It's good for people of all ages, the radish is. And another thing it can do is improve your immunity. Also, great anti-cancer food. Now, in modern science, we know that the radish contains vitamin C, potassium, and it can lower your blood pressure if you have elevated blood pressure. It promotes the generation of collagen. So one of the best parts about the radish is it can thicken our skin and create an anti-aging from the inside out. And again, can help prevent diabetes. The radish. Please like and subscribe to our channel to continue our wellness tips, where life becomes better living. Make it a great day. Jusqu'à demain. Hey guys, Dr. Liz here, just checking in. I wanted to give you guys some tidbits on TCM medicine and how TCM can actually work. So there's 12 meridians in traditional Chinese medicine. There's actually 20, but we're going to talk about 12 today, the 12 meridians. So they are based on the visceral organs and their bowel systems. So the first visceral organ would be the lung.
and it's the most exterior organ in the human body. And that's why when we catch a cold or something, oftentimes it goes to our lung. Its bowel system is the large intestine. And what's clever about that is because they're connected that way, they can actually release heat from like a lung cancer condition or various different types of dryness in lungs or different issues pertaining to the lung by doing acupuncture points or sending herbal medications to the large intestine channel as well as the lung channel to improve the condition. So the first meridian is the lung meridian, and its bowel system is the large intestine. The second one we're going to talk about today would be the heart meridian. And the heart meridian is a very important meridian, as they all are. The heart is another visceral organ, and its bowel system is the small intestine and can work similarly. So you can do acupuncture points on the small intestine channel to release heat or make stronger the heart through doing acupuncture points through that channel as well. The third one would be like the kidney. The kidney channel would be a third visceral organ, and its bowel system is the urinary bladder. The liver is a fourth visceral organ, and its bowel system is the gallbladder, which is an extraordinary organ and channel pathway. And the fifth visceral organ is the spleen, and its bowel system, is the stomach. And the sixth visceral organ, which is not really a visceral organ, but we talk about it because we look at it separately from the heart, and it's called the pericardium. And the pericardium has its own channel, and it physically and anatomically encompasses the heart. So that is the sixth meridian pathway, and its bowel system is what we call either the triple warmer or the sand jow. And those are all really exceptional pathways that have been known for thousands and thousands of years by the ancient wisdom in medicine. And it really is the foundational medicine that's been recorded in ancient medical literature. So those are the 12 pathways, the 5 visceral organs plus their 5 bowels, and then we add the pericardium and its bowel system, which is either known as the sand jow or the triple warmer. Then in addition to that, there are 8 extraordinary pathways which have the capacity to transform DNA, like change the stem cell therapy. So we're not going to get into those today, but I did want to give you the professional courtesy of knowing a little bit more about TCM, traditional Chinese medicine, the meridian pathways, what they are, and how they pertain to your vital health. Okay, so I am Dr. Liz, a doctor of acupuncture and oriental medicine. Please like and subscribe to our channel for additional wellness tips daily and future knowledge about traditional Chinese medicine and food therapies. Make it a great day, and we are where life becomes better living. Jusqu'à demain.
Good morning, Dr. Liz here, doctor of acupuncture and oriental medicine, checking in where life becomes better living. Today's topic is the apple. The apple. An apple a day can effectively keep the doctor away. Lowers blood cholesterol, stabilizes the blood sugar, lowers blood pressure, can help prevent constipation and regulate our bowels. Good for weight loss in the sense that it suppresses our appetite. Giddy up to the apple. And it can help, again, regulate our bowels by treating diarrhea, preventing constipation, It is like a natural toothbrush. The apple. Do you have bleeding gums? Do you have excess plaque in your mouth and your teeth? The apple can help prevent the tooth decay, help stop bleeding gums. It's packed with chemicals that are so nutritious, loaded with vitamin C. Wash the apple well and be sure to eat its skin. Store it in the fridge, but best to eat at room temperature, or you can cook the apple a little bit. So high in vitamin C, it's great, once again, folks, for chronic gum disease. So it has loads of fiber, and it's really good for people that used to smoke, or even if you still smoke, or if you have taken pills to prevent you from getting pregnant. That can cause side effects, and taking and eating apple every single day can help rebalance your human body if you have been on birth control pills and or if you smoked or if you do smoke. Eat the apple. Yes. So, Dr. Liz, Doctor of Acupuncture and Oriental Medicine. Giddy up, all you folks. To the apple a day keeps the doctor away. Please feel free to like and subscribe us so we keep these wellness tips coming your way. And jusqu'à demain. Good morning. I'm Dr. Liz Perry, and I'm going to talk to you today about the pear. It is sweet in taste and it's cool constitutionally. It goes and helps to heal and empower our lung and our stomach. The pear does. It is an excellent treatment choice for both anxiety, restlessness, and dry mouth. So hang on tight, because at the end of this video, I'm going to share with you a special recipe you can make to treat yourself there at home or help improve your condition. I'm Dr. Liz Perry, and I make videos about health, wellness, and the general quality of life, because I believe by combining best practices from around the world, we optimize healthful living. So the pear, consuming the pear, helps also to lower our blood cholesterol. It helps with insomnia, sleeplessness, and it's great for IBS because it also regulates us. It aids in digestion, and it's loaded in potassium. The pear is. It's great to treat the loss of voice, laryngitis, and it's loaded also, or has a fair amount of beta-carotene. Vitamin B's such as B1, B2, B3, B6, folic acid, vitamin C, magnesium, calcium, iron, phosphorus, and the pear contains tannins too, which are like natural hormonal substances that help balance our human body. So it's a great choice, especially in the summertime as it gets a little bit warmer outside, because the pear will also help to cool us down. Okay, so plug it in for the recipe. In fact, try this recipe whether you feel a little bit anxious or whether you have mental restlessness, nervousness, or thirst, or even if you have hay fever or allergies. You want to combine in your juicer pure pear juice with lemon juice. And you can decide if you want a little more pear juice or a little bit more pure lemon juice. But mix it up, or if you're not sure, just do 50-50. And you can drink between 1 and 3 cups daily of this decoction, and try that for at least a week and see how it helps. Thanks so much for plugging in. This is Dr. Liz, where life becomes better living. And if you enjoy our wellness tips, please feel free to like and subscribe to our channel, where we will keep these healthy, fun wellness tips coming your way. Ajiska Domat. For those of you out there that say you don't give a shh, you just may want to plug in. Today's topic, the prune. Well, it is known as a very powerful laxative. The prune. It is known that it has very high incidence of fiber. It's high in fiber. The prune, that's right. Giddy up to the prune if you don't give a shh, if you know what I mean. That's right. And because of that high fiber that the prune has, and again, that's if you don't give a shh, you might want to buddy up to the prune, because it can very likely reduce the risk of getting cancer of the colon. That's right. So you people that don't give a shh, you may want to start to buddy up to the prune. This is Dr. Liz, functional medicine doctor, practicing alternative medicine. Buddy on up to the good old prune, folks, and make it a great day, and hopefully you'll turn some things around, and instead of not giving a shh, perhaps now you will. Jiska Domat. Oh, and if you do like these wellness tips, please feel free to like us and subscribe to our channel so we can keep these funny and authentic and helpful wellness tips coming your way. Ajiska Domat. Hi, I'm Dr. Liz Perry, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. We will talk to you today about different types of hernias, and very specifically, the hiatal hernia and the two different types of that type of hernia. So first and foremost, hernias, there's many different types of hernias. There are epigastric hernias, femoral hernias, diastasis recti hernias, inguinal, umbilical, incisional hernias, and hiatal hernias. There's the paraesophageal, diaphragmatic, and obturator hernias as well. So the bottom line is the hernia is the bulging of an internal organ through a weak area, and most of them occur in the abdomen region. So today we will talk very specifically about the hiatal hernia. The hiatal hernia. Hiatal hernia is, there are two different types of hiatal hernias. One that occurs in the upper portion of the stomach, typically all hiatal hernias, and it bulges into the opening of the diaphragm. There is the sliding type of hiatal hernia and the paraesophageal type of the hiatal hernia. Treatment for both of them in biomedical science is the same. And similarly, somewhat the same as well in traditional Chinese medicine and functional medicine. So a couple things that will help you right out the gate is, first, I just want to make sure everybody understands what is a hernia. So a hernia is when their muscle becomes weak, and it, specifically with the hiatal hernia, grows up into the diaphragm region and opens into a weakened area within the diaphragm and bulges through. So that is, bulges through an opening in the diaphragm. So one thing you don't want to do when you have this type of a hernia is do not eat before bed. That has to stop if it ever did start. Do not eat before bed. Another thing you can do to make yourself more comfortable and lessen the GERD and improve the breathing, if those are symptoms, with your personalized hiatal hernia, is elevate your head while sleeping. And if you do smoke, I highly suggest that you quit smoking. Now, another good idea on lifestyle changes, if you have been diagnosed with any type of hiatal hernia, is to stay hydrated. Drink plenty of water, room temperature water, or even a little bit warm water. High pH water is preferred because so the organs maintain a higher level of absorption this way, and so that the body can stay more effectively hydrated. Foods to eat: apples, bananas, pears, and prunes. Fiber-rich greens and fiber-rich vegetables are great choices if you have been diagnosed with any type of a hiatal hernia. Oatmeal is another good choice. What to avoid? Avoid strenuous exercise. Small, light meals are a good choice. Exercises such as swimming or walking or very light cycling can work if you have a hiatal hernia. Best to avoid any type of overexertion. So thanks for checking in. Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today's topic is the hiatal hernia, and it's best to work with an acupuncture physician about this so that you can optimize your wellness plan. Thanks again for checking in. If you liked this wellness tip, or if you suffer from any type of hiatal hernia, please feel free to like and subscribe to our channel so we will keep these wellness tips coming your way. One of the other things in traditional Chinese medicine, the pathogenesis of any type of a hernia is where there's a weakening of the sphincter and or a weakening of the muscle tissues, which is why it tears and punctures through from the stomach to the diaphragm, is called spleen qi deficiency pattern. And that means in traditional Chinese medicine, the spleen is responsible for the holding of everything, from a blood vessel to your muscles. The spleen dominates the muscles and the lips and the tongue and many other insights. So when the sphincter is weak, that is due to, according to traditional Chinese medical theory, it is due to spleen qi deficiency, as is the type of stroke if you have a bleed, as opposed to a blockage that would be known as spleen qi deficiency, as is the muscle bulging in the case of a typical hernia and either type of the hiatal hernias, be it the sliding and or the paraesophageal. Those are both considered pattern differentials of a baseline framework known, according to traditional Chinese medical theory, as the spleen qi deficiency. So, how do we improve the condition or avoid any further types of hernia activity? We tonify the spleen. And how do we do that? Through food therapy, some of such that I just mentioned to you that will tonify the spleen. But furthermore, acupuncture and the traditional modification use of traditional Chinese medical formulas to tonify the spleen are also a very good choice. Furthermore, one final tidbit for those folks that are suffering from any type of hernia, even though today's topic was very specific about hiatal hernias, is drink and eat warm water. Stay away from cold drinks and raw cold foods. Too many salads, sushi, ice cold drinks, cold beers and martinis. Those are all considered cold, raw drinks and foods which weaken the spleen. So don't do that. If you're overweight lose some weight, work on losing some weight through improving the diet, light walking, light cycling, and swimming. So again, thanks so much for checking in with Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. And please feel free to like and subscribe to our channel, where we will keep these wellness tips coming your way. And jusqu'à demain. Hey, good afternoon. Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today's topic is prostate health. Do you suffer from frequent nighttime urination? Has your urinary stream become weaker or segmented or broken since you've become in and around the age of 50? Do you suffer from varicocele or prostatitis? I'm going to give you some tips today on how to improve your prostate health. Benign prostate dysplasia or benign prostate hyperplasia is one of the most common urinary diseases affecting men, typically after the age of 50. I will be sharing with you 5 different modalities that you personally can incorporate into your life through professional usage to improve your prostate health. Number 1 will be food therapy. Number 2, the Kegel. Kegel it, boys. Number 3, acupuncture and how it can help very effectively too. Number 4, we'll talk about custom therapeutics of TCM, traditional Chinese medical treatments that men have used for thousands of years to effectively keep the vital health of their prostate going and their urinary system and their sexual system. It works. It's very helpful. Number 4, that was number 4, the traditional Chinese medicine, which does and is scientifically shown to help to regulate, in many cases, the urinary stream, many cases improve or eliminate the swelling of the prostate, such as in BPH, and often lower the PSA and improve, as I mentioned, the entire urinary genital health at large. Number 5, auricular therapy. The ear. So to stay up to date on your prostate health and general wellness, we hope you enjoy this session. And if you do like it, please feel free to say that you like it and subscribe to our channel so we can keep these wellness tips coming your way. I'm going to start by talking about the food therapy for your prostate health. So, number 1, that will be useful to you, gentlemen, for your prostate health. I'm going to give you 5 different foods that you can add to your diet. And I suggest you do it consistently unless you have an allergy or some obvious discomfort with this particular. The green tea. Number 5, we had the garlic. And number 6 is the curcumin. The curcumin reduces the expression of the androgen receptors to the prostate specific antigen, otherwise known as your PSA gene. 6 foods, guys. You got a bonus one. Okay, moving right along. So next we're going to talk about the Kegel, then acupuncture, then the custom herbal therapeutics from traditional Chinese medicine, and then your ear, and how they can optimize your prostate health and wellness by utilizing them all alongside of one another simultaneously to get you back in the game optimally. Okay, so the Kegel is nothing more than squeezing the pelvic floor muscles, and it's almost the best way to describe it is when you're urinating in the middle of the night, in the day, what have you, just try to stop your stream. 3 to 5 seconds count. 1 Mississippi, 2 Mississippi, 3 Mississippi, and you can do that up to 5, and then release and let it flow again. And you want to try to do that 10, 20, 30 times a day. Whether you're peeing or whether you're at a traffic light, you can do that similar style of exercise. But it's also good to practice when you're actually doing the urination. Now, thirdly, we are going to talk about acupuncture. Acupuncture, there is a very special, powerful point in acupuncture. And no, we don't go near the visceral organs or the organs near the genitalia. How we can, in many cases, improve the condition of the urinary flow, the health of the prostate, and the swelling of the prostate is through different prescriptions and protocols of acupuncture in the meridian organ system pathways. So for the prostate health, we commonly use a point called Zigong Zhui. Can you say that? Try it with me. Zigong Zhui. That is a very powerful point that is only part of the prescription. So you need to go to see an acupuncturist or a doctor of acupuncture and oriental medicine to have this properly and effectively done and repeatedly for a series to make sure it helps you and that it helps you sustainably. But one of those key points again, fellas, is called the Zigong Zhui, and it is about 1 inch in the center above your pubic symphysis bone and about 3 inches out to the side from that area. And we bilaterally place little pins, and no, it doesn't hurt. And a lot of times we can even add some electrical stimulation, which helps to circulate those meridian pathway organ systems to help optimize your urinary health system and prostate health. Okay, works for some other things too. So that would be number 3 tips. So we talked about the food therapy, and we talked about the Kegel, number 2. And number 3, we talked about acupuncture, and one of the primary points that is not done alone or by itself, but in an intelligent prescription, it will absolutely and is scientifically shown to help improve the condition of your prostate health and your urinary regulation. So number 4, we are going to talk about TCM, custom therapeutic herbals, or traditional Chinese medical formula. So those are really helpful and can improve the health of either A, lowering the PSA in some cases, and B, regulating the strength of the legs and the regulation of the urinary system so that you're not stopping and starting or have as much nighttime or frequent urination. How about that? Would that be helpful? Okay, so let's talk about that. So we use a variety of different ones, and this is a warning for you not to prescribe to yourself any of this. You need to go and see your regular primary care acupuncture physician or doctor of acupuncture and oriental medicine or acupuncturist in your area. That's right, boys, but it's well worth the journey. Here's why. So things like Jingwei Shenqi or Bajing Tong can improve the health of the urinary genital system, regulating, as I said, the urinary flow and decreasing, in many cases, the oversized prostate. So depending on your personalized diagnostic of what exactly is going on pathophysiologically with you, we would then determine what is most suitable, mix it together for you or prescribe for you, and you're on your way. And you may have to take it for a little while to make it sustainable, but it will go in and ultimately help improve the condition of the root cause of your prostate health. Furthermore, we are going to talk about number 5, which is auricular therapy. So these are our ears, and we like to use them in science for medical treatments many times because they are the closest microsystem to the brain, okay? So even in terms of the prostate health, there is a very specific point for the prostate in our ear, and it actually has an effective point, again called the prostate point, in the auricular system in our ear, and it's located in the cymba of the conchi, and that can help in the treatment of the prostatitis, UTI, blood in the urine, spermatoria, or premature ejaculation, to name a few things that it helps to treat. Hope that was helpful, gentlemen, and thanks for tuning in. So, Ask Dr. Liz, TCM Tidbits, where life becomes better living. Be sure to like and subscribe to our channel so we can continue these wellness tips coming your way. Jusqu'à demain.
Good morning, Dr. Liz here, doctor of acupuncture and oriental medicine, where life becomes better living. Please be sure to like and subscribe to our YouTube wellness channel, Dr. Liz Perry, Dr. Liz. Today's topic is kidney health. So, can you tell me about our kidneys? So I can, and what the job is of our kidneys is to remove waste, products from our blood, and to regulate the water metabolism in our human body. So the kidneys are a filtration system, that is correct, and they are responsible for filtering the bad stuff out of our blood and dispose of that bad stuff through urination. So a lot of people in America sadly do have kidney failure, kidney problems. So let's talk about that and how to prevent. So kidney failure refers to the loss of the function of our kidney's ability to eliminate waste and regulate the water levels within our human body. So interestingly, we can live with kidney disease without even knowing it for a really long time. So we are all born with about 2.5 million nephrons, and we ain't even gonna know that until over 70% usually, do we even have mild or any symptoms at all of the nephrons being damaged or gone. So we can actually live with 30% of those 2.5 million nephrons without sometimes any symptoms. But once you lose those nephrons, there's not any doctor that can replenish them. And they're at some level measured with the EGFR in our metabolic panel. So it's always good for you to familiarize yourself with your CBC and metabolic panel so you can monitor your kidney health. It's a good idea. And see how your kidney health has changed. So even if your doctor says, oh, you're doing great, Mrs. Miller, so-and-so, wonderful. But how do we measure our own? Because sometimes we get so busy, you're not able to really clearly see how you're evolving, which is a good thing to do. So some of the symptoms of kidney failure would include like skin issues like itching, muscle cramps, nausea, sometimes a loss of appetite, sometimes you'll have swelling in the feet, or even slightly shortness of breath, and blood pressure is also controlled by the kidneys. So here's the good news. You can prevent kidney problems. Who's most prone, and the best way to do it is eat a lot of vegetables. Vegetables are really good for the kidney, And fruits clean the blood. So fruits are good too, just not too much sugar of the fruits. So anyway, who's most prone to kidney disease? So the data shows that African Americans, Hispanics, and American Indians are at the highest risk for developing the kidney disease. And this is due in partly to the high rates of diabetes and high blood pressure in these communities. Now, eating healthy, as I mentioned, can protect us against renal cell carcinoma, both directly and indirectly. And that is important to know. So like I said, eat more vegetables. It's a good idea for all of us, for anything, just about. I personally, as a TCM doctor, think it's best to cook your vegetables as opposed to salads all day long and raw fruits and vegetables, but that is your personal choice. If you eat too much raw all the time, it can, in some people, weaken the spleen, which we don't want, can slow our metabolism and so forth. So if you're going to eat salads or raw cold foods, maybe have just a cup of warm water with lemon in it, or just a cup of warm water before you digest the raw foods, which are nutritionally good. I'm just saying, as constantly cold can, in traditional Chinese medicine, over time, slightly weaken the spleen and cause bloating, gas, and that kind of thing. So anyway, use your best judgment. Back to our kidneys. So a lot of people, like over 60,000 people are diagnosed with kidney cancer every year, and I'd say like over 15,000 people a year in the States die. So we do need to eat healthy, eat more vegetables. There is lots of wonderful foods in my book, Live Longer, Eat Better, that go to the kidney directly and that will nourish the kidney. And some of the foods that are really good for the kidney are black beans, kidney beans. Actually, most beans, they actually look like a kidney. I mentioned it in another video. They look like the kidney a lot of times, and you can double, triple check, but usually are good for the kidney, as well as goji berries go to the kidney. They're sweet, they're a fun little dried fruit snack, and black sesame seeds. So a couple little kidney tidbit, preventative health. Kidneys also in charge of our sexual organs, the health of our hair in many cases, our bones and our bone marrow, and our brain. So a lot of this in traditional Chinese medicine is known to be held responsible to the kidney and the kidney pathway. So anyway, today's topic, folks, was the kidney. I hope that helps. Please like and subscribe to our channel for more further wellness tips. And again, thanks for plugging in to Ask Dr. Liz. Make it a great day, and jusqu'à demain. Good morning, Dr. Liz here, doctor of acupuncture and oriental medicine, where life becomes better living. Today's topic is 6 simple foods to reduce our cholesterol. Research has shown that these foods have been shown to reduce cholesterol. Black beans, eggplant, flax seeds, kale, sweet potato, and oats. Black beans have flavonols and saponins to help reduce the cholesterol. Eggplant is high in fiber, and it contains vitamin K, B6, folate, vitamin C, potassium, and reduces the LDL, the bad cholesterol. Flax seeds reduce total cholesterol, and kale lowers both the triglycerides and cholesterol. Sweet potato, or the Chinese yam, will lower the blood serum cholesterol. And oats. Oats have soluble fiber, which attaches to cholesterol particles and helps to remove them from the human body at measurable levels, reducing cholesterol. Thanks for checking in. Dr. Liz, doctor of acupuncture and oriental medicine, where life becomes better living.
please subscribe to our channel so we keep these wellness tips coming your way. Jusqu'à demain. Hey, Dr. Liz here, checking in. Doctor of Acupuncture and Oriental Medicine, providing you with the daily wellness tips. And please be sure to like and subscribe to our channel below. We surely appreciate you, and we welcome any feedback and comments down below. We will take them into consideration strongly and make you a personalized video. Meanwhile, today's topic is black beans. There's lots of reasons why a bunch of black beans are in front. Black beans, according to ancient wisdom, were known as grains of the kidney. Their flavor is sweet. Their temperature is cool and neutral constitutionally. And the function of black beans are they actually do help protect our kidneys. Interestingly, things that look like the kidneys often are good for the kidneys. And black beans are very good for your kidneys. They strengthen your digestion. They brighten the eyes and they detoxify the body. When I say they brighten the eyes, they actually improve lots of different, they're capable. The benefits of them is to improve lots of different types of eye conditions. So if you have any problems with your eyes, it would be good to consume black beans. They also help to prevent constipation, promote regularity of your bowels, very important for long life and good health. And they promote healthy bacteria in the colon. So they're also good for back pain, knee pain, infertility, and seminal emissions. Black beans. The organ system that black beans go to are the kidney and the liver predominantly. So they're good for the liver too, and they're good for the health of your kidney. They also are very much the same, similar to soybeans in terms of the nutrients, but the neutral in nature, they are neutral in nature and they're sweet. So they're a cool type of a tonic that also, as we mentioned multiple times here, they're good for the kidneys. They also strengthen your spleen. So that's good for people that have had a miscarriage or they have had any type of prolapse. When you strengthen the spleen, it helps eliminate prolapse as well. So they detoxify things. Again, they're very good for the eyes, and they're highly nutritious. Matter of fact, black beans, they contain over 50% of protein. 50% of protein in black beans. Now, modern day science teaches us that they help regulate our cholesterol, our blood pressure, our blood sugar. They even improve a lot of, obviously, different cardiovascular health components. They improve our gut health as well. They protect us against cancer. They protect against neurodegenerative disease. And they promote mineral absorption. So leaky gut. Now, I know they're a lectin, so that's a Stephen Gundry thing, but as far as that is also scientifically proven, though, that they can help aid in digestion by improving absorption. Make it a great day. Dr. Liz, acupuncturist and doctor of Oriental Medicine. Please be sure to like and subscribe to our channel below. Bye for now.
Liz here, functional medicine doctor, using acupuncture, Oriental medicine, and homeopathy to help you feel better from stress, anxiety, insomnia, and difficult to treat diseases. Do you feel stressed? Do you need to rest? Do you get anxious or feel uneasy more often than not? Are you irritable or quick to snap or angry? Or do you feel restless, find yourself overthinking?
or have a chronic monkey mind. Can't slow the mind down. There's a powerful point called yin tongue, and this wondrous point is located at the glabella, between the eyebrows, close to the third eye, right about there. Eyebrows, glabella, right there. It's called yin tongue. Yin tongue is clinically proven to calm the mind. In English translation, yin tongue means hall of impression. That's where your third eye is. It helps us to relax, calming the mind, treats insomnia, infantile convulsion, restlessness, anxiety, headache, epistaxis, otherwise known as nosebleeds, and heaviness of the head. I don't know if you've ever been electrocuted, but those unfortunate folks that have been, a lot of times they feel a really heaviness of the head. Yin Tong can help that aspect of the treatment. It benefits nasal congestion. And if you're afraid to fly, say hi to Yin Tong. Calms the spirit. So thanks for checking in. This is Dr. Liz, functional medicine practitioner, using acupuncture, herbal therapies, and best practices from Germany and around the world to help improve your condition. Make it a great day, and if you like this wellness tip, please feel free to like and subscribe to our channel, which is all about health, wellness, and quality of life. Jusqu'à demain. Hey, Dr. Liz here, doctor of acupuncture and oriental medicine, where life becomes better living. Today's topic is the cranberry. And the cranberry goes into the large intestine. It goes into the bladder organ pathway. And it also goes and affects the kidney organ pathway when you consume the cranberry. The cranberry can be utilized to effectively prevent, in many cases, a true UTI. And that is because it can help prevent the bacteria from sticking to the ureter. Not because, so it's better at preventing it than it is at treating it. The watermelon is better at treating the UTI. That is, if you take the entire watermelon, clean it well, not a seedless watermelon, that doesn't work so well. A real non-GMO watermelon. Cut it into a piece, the whole thing, the seed, the rind, the white part, and the pink flesh. Grind it up in a ninja and drink it down. That will more effectively treat a UTI than the cranberry. But I'm going to still tell you more about the cranberry here. The cranberry can, again, prevent urinary tract infections or cystitis. It can help improve the condition if you already have one, but likely it won't fix it, as the watermelon oftentimes can do. And the cranberry can kill certain viruses and bacteria. It also is helpful in preventing kidney stones, accumulated calcification in the kidneys. Cranberry can help prevent. It's loaded in vitamin C. It has quite a bit of potassium, and it is really good for us. So, a lot of time where I come from, the cranberry was quite popular. Plymouth, Massachusetts, Cape Cod, Massachusetts, southeastern part of Massachusetts. There were a lot of cranberries there that I believe originated from that area, or certainly there was many of them. So it can even help and reduce a diaper rash. The cranberry can. So giddy up to the cranberry, new moms. It also is sometimes a pretty low-calorie juice if you drink it without all the sugar. And it is viewed as a preventative, not as a substitute for an antibiotic drug. So, topic today was the cranberry. Thanks so much for tuning in to Dr. Liz, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. If you like our wellness tips, please feel free to like and subscribe to our channel so we keep these wellness tips coming your way. Jusqu'à demain. Hey, good afternoon. Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. Today's topic is gout. Do you ever suffer from gout? If so, I'm sure you want the gout out. So gout is a situation that when we consume too many foods that are rich in purines, the body breaks it down into uric acid. And when it has too many purines and the body can't handle that, it ends up having too much uric acid. So gout occurs when there is too much uric acid. And that is produced inside our human body. Well, purines come in the form of different types of meats, fish, and alcohol. So play it safe, folks, and stay away from the three. No meats, no fish, and no alcohol if you want to dodge the gout. If you want the gout out, don't eat the meat, the fish, or the alcohol. Now, what you do want to eat is fresh fruits and vegetables and nuts and grains. Avoid the stress and get some rest. That's it, giddy up, avoid the stress and get some rest. Foods you do want to eat are bananas. Celery juice is a goodie, guys. Celery juice. So basically, gout is a form of arthritis. It's a damp heat form of arthritis. So celery juice can be very effective. You can snack on the banana. You can buy a bunch of celery and juice it up 2-3 times a day. Do that. Watermelon's very good. And tomato. The Fortunate 5 for gout getting out. You want the gout out? Eat the Fortunate 5. Banana, celery, watermelon, tomato. Actually, let's add lemon and coffee to that. Okay, so we got banana, celery, coffee, lemon, tomato, and watermelon. Sexy 6. We went from the Fortunate 5 to the Sexy 6 to get the gout out. Now, little bonus, guys. Dandelion tea and hibiscus tea, if you want to switch it out. You can also eat and drink those two goodies that you can find at your local supermarket or online. Dandelion tea and hibiscus tea will also help get the gout out. Okay, and another goodie is you can get it up to your acupuncture physician because they know how to treat it very timely and effectively. So, today's topic was gout and how to get the gout out. Thanks so much for checking in. Dr. Liz, Doctor